Good morning, good afternoon, everyone, and welcome to our 988 Suicide and Crisis Lifeline. What does it mean for educators webinar? During this webinar, you'll learn more about the 988 Lifeline and how K-12 educators and educational partners can use this important resource to further support their school communities. This event is brought to you by the U.S. Department of Education's Readiness and Emergency Management for Schools Technical Assistance Center, also known as the REMS-TA Center, and the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. My name is Janelle Hughes, and I serve as the project director here at the REMS-TA Center. We do want to take a moment to share a few tips for engaging with the platform and us throughout the event. There is no dial-in, and you can access the audio through your computer speakers. We also welcome you to download and share the resources that we will link throughout the event with your school safety and crisis response partner. We invite you to post questions in the chat or communicate any technical difficulties that you experience by clicking the Q&A button at the bottom of your screen. We will be answering content-related questions after the presentation and panel discussion. And after the live event, you can also feel free to send any questions to us at the REMS-TA Center via our help desk. You can email info@remstacenter.org. This webinar is being recorded and will be made available in an archive form on the REMS-TA Center site within 7 business days following today's live event. Captions can be generated by hitting the Show Captions button at the bottom of your screen. We are truly excited to have a full panel today as we explore this important topic. That includes Ruth Ryder, Deputy Assistant Secretary for the Office of Policy and Programs within the Office of Elementary and Secondary Education within the U.S. Department of Education. Monica Johnson, the 988 Behavioral Health Crisis Coordinating Office. Yashi Duhan, a 988 counselor and also a qualified mental health professional supervisor with Integral Care. Lisa Kaposha, a social worker and adjustment counselor, and Addison Egabine, a teen with a lived experience. We're so grateful to have each of you joining us today. You'll have a chance to learn a little bit more about each panelist and presenter later during today's event, but I would like to start with an introduction of Ruth Ryder. Ruth is the Deputy Assistant Secretary for the Office of Policy and Programs within the Formula Grants and the Office of Elementary and Secondary Education at the U.S. Department of Education. OESE implements programs to support disadvantaged students under the Elementary and Secondary Education Act, as amended by the Every Student Succeeds Act. In this role, Ms. Ryder oversees a broad range of management, policy, and program functions related to formula and discretionary grant programs under the ESSA. I'll turn things to Ruth now to share a welcome message from the U.S. Department of Education. Ruth?
Thank you so much, Janelle. Thank you also to REMS-TA Center for all of your work in this area, and to our partners at SAMHSA and 988 who have come together to provide our stakeholders with some really critical information about the 988 Suicide and Crisis Hotline. I'm sure many of you know about the 988 Suicide Prevention Site that has been active since 2005, but today we will hear how those services can be shared and utilized by school communities. We know that youth suicide rates are increasing, and suicide is the 3rd leading cause of death for adolescents 14 to 18. Firearm suicide among young people ages 10 to 24 is at its highest rate in more than 20 years. According to the latest CDC Youth Risk Behavior Survey, which addresses youth suicide and suicide ideation, young females and LGBTQ+ students are disproportionately impacted. Factors leading to increases in suicide and suicide ideation include feelings of isolation, disconnectedness, access to lethal means such as firearms, and those with less than a high school education. The department and administration as a whole are committed to supporting schools and communities in improving conditions for learning, which is why the department has prioritized this work in one of the three pillars of the Secretary's Raise the Bar K-12 initiative. We know that safe, positive, predictable school environments where students feel a sense of belonging and connectedness result in not only greater student success and learning, but also serve to prevent and mediate feelings of isolation and anxiety and reduce incidents of harassment and bullying. As part of the Bipartisan Safer Communities Act, known as the BSCA, the department awarded nearly $1 billion in Stronger Connections grants to states for high needs LEAs. These programs support safe and healthy learning environments in which teachers and students can focus on teaching and learning. SEAs can use these funds on a broad range of activities, including mental health staff and supports, social, emotional, and behavioral learning, positive behavior interventions and supports, school counseling, and mentoring programs. In addition, the BSCA provided an additional $1 billion to support 2 discretionary grant programs to increase the number of mental health professionals in schools. The School-Based Mental Health Services Providers Grant and the Mental Health Service Professional Demonstration Grant programs. Collectively, these programs will recruit, train, place, and retain school-based mental health services providers, particularly those from diverse backgrounds or from communities that they serve. The department awarded 264 grants that will enable communities to hire approximately 14,000 mental health providers over the next 4 to 5 years. In March of 2023, the U.S. Department of Education released a guidance document called Guiding Principles for Creating Safe, Inclusive, Supportive, and Fair School Climates for students and staff, featuring specific recommendations for evidence-based practices that allow students to learn, grow, and be successful. To enhance state and local implementation of these guiding principles, a collaborative of technical assistance centers supported by the department's Office of Elementary and Secondary Education, Office of Safe and Supportive Schools developed a series of 4 fact sheets. This series describes best practices and approaches to help support the fact sheets and the guiding principles. The collaborative of technical assistance centers also offered a series of webinars, which you can access at the link being provided in the chat. This was called the mini-series on supporting students' social, emotional, behavioral, and academic well-being and success. Safe firearm storage is one of many preventative actions that can be taken to help keep our school communities and school buildings and grounds safe. When firearms are stored safely, it can help prevent them from getting into the hands of children and teens who may use them to intentionally or unintentionally harm themselves or others. Last week, the Education Secretary, Miguel Cardona, released a letter to school principals and district administrators on safe firearm storage, bringing to their attention that school principals and district administrators have a unique capacity to help save lives. The letter highlights ways they can bring attention to this important issue. To support this effort, the REMS TA Center developed a sample letter template that principals and school district administrators can send to families, guardians, and caregivers to share essential information about safe firearm storage. And you can find that template letter and access to the Secretary's letter at the link being provided in the chat. These are just a few of the many resources available from the Department of Education that can support schools and communities in reducing the risk of suicide. Thank you to our colleagues at SAMHSA and across the government for the important collaboration on this work. And especially thanks to all of you for taking the time to learn how we can better support students in crisis. Finally, Janelle, thank you and the REMS TA Center for your important work in ensuring safe, supportive learning environments for all students. And back to you, Janelle.
Thank you so much, Ruth, for that welcome message. Let's now do a quick run through of our agenda for today's webinar. We will start by just providing an overview that connects this important topic to the overall topic of emergency management planning and emergency operations plan development. We'll then hear an overview from Monica Johnson of the 988 Lifeline, and then we'll move our way into our panel discussion and Q&A session. Finally, we'll end with a few key resources that we'll walk through to support your work in these areas. Before we move into our presentation, let's just get a sense of who's joining us today. And so you'll see this poll question pop up on your screen. Please pick the role that fits you best. And we just always love to get a sense, and we always tend to see a nice blend in terms of representation. Right now, and we'll broadcast these polls in a moment, I am seeing that we have more than 50% of us joining our school counselors, social workers, or mental health support staff. And so, I think you're definitely in the right place today. You're definitely partners in these efforts, but I also see that we're joined by school administrators, school safety and security officers, school nurses, teachers, and other staff, as well as community organizations. So all of these roles are so important and so critical. And as we always emphasize here at the REMS TA Center, emergency management planning and thinking about the before, during, and after aspects of an emergency, it really requires support from a multidisciplinary set of individuals and stakeholders. So thank you all for joining us today. School emergency operations plans provide a great opportunity to outline goals, objectives, and courses of action. And schools, school districts, and their community partners work together to determine how to manage those aspects of planning across a variety of emergency types, including mental health crises and other emergencies. Ruth mentioned the CDC's Youth Risk Behavior Surveillance Data Summary, and it did note that in 2021, more than 4 in 10 students felt sad or hopeless, and nearly 1/3 experienced poor mental health. Also, in 2021, the report showed that more than 1 in 5 students seriously considered attempting suicide, and 1 in 10 actually attempted suicide. And so school EOPs are not only a response and recovery tools, they are also prevention and protection tools that schools can use as they consider how to work with partners across the whole school community and others to create safe learning environments for students, and also to offer students the supports and tools they need before emergencies take place. Those EOPs really need to develop by school level emergency planning and response teams with membership from the district's core planning team. And why collaborate? I think because the planning and development of an EOP requires the expertise, again, of a diverse group of people so that it reflects the diverse needs of the school community. And everyone has expertise to contribute, as we saw from the poll. That includes teachers, administrators, families and parents, community engagement specialists, and of course, mental health professionals and support staff who will be there to provide support needed to students in crisis. And the formation of this multidisciplinary planning team really takes place in step 1 of the 6-step planning process that is outlined in the Guide for Developing High-Quality School EOPs and its companion guide for school districts. So we're going to take a moment now to walk through each step of that planning process and discover how teams can work together to develop EOPs that can help support students as they deal with crises. So again, in step 1, we're forming that multidisciplinary planning team, which is going to really add value to the breadth, depth, and scope of EOPs. And the mental health coordination team really plays a key role in supporting not only response and recovery, but again, prevention, protection, and mitigation in the event of a variety of incident types. Key members of this team might include, but of course not be limited to, school psychologists, counselors, social workers, nurses, IEP staff, and many others. If a student is having a crisis at school, members of this mental health collaboration team can meet with the student to help address the situation. And if the student is having suicidal thoughts, he or she will be encouraged to share those feelings with a trusted person, and the safety protocol out will be completed with a crisis team member. And I think this is a great time to think about how the 988 Lifeline can be of additional support in those efforts. In step two, the planning team looks at those hazards and threats unique to the school community and prioritizes them using assessments, including site assessments, capacity assessments, culture and climate assessments, and threat assessments. And members of that mental health coordination team can lead or serve as a member of those various assessment teams, including those responsible for creating and administering those assessments. They may also provide training in psychological first aid and trauma-informed care, and that need might be discovered via a capacity. They are going to also play a key role again in those culture and climate assessments and understanding perceptions of safety. And again, mental health staff can also be a part of behavioral threat assessments, focusing not on what a particular student is doing and saying, and not on what the student looks like, but really emphasizing the supports that can be provided to students who may be at risk of harming themselves or harming others. In step three of this planning process, the team decides which of those threats and hazards will be addressed in the EOP, and then develops goals and objectives for each of them. And members of that mental health collaboration team can participate in the development of those goals and objectives. And we provided some examples on the screen of possible goals for responding to a mental health crisis, which might include before ensuring that there is a mechanism in place for students and staff to request mental health support, providing that psychological first aid, which can include recommending that students and staff access resources such as the 988 Lifeline. And then after, providing those individualized services to students, staff, and/or families. And then in step four, the team is building upon those goals and objectives created in the previous step and assigning specific courses of action that really address the who, what, and how for achieving them. So together they form the annexes or portions of the EOP, such as a suicide prevention annex, and/or functional annexes such as a recovery annex, which may be activated when a mental health crisis may turn into a school emergency. It's important for members of the mental health collaboration team to participate in scenario-based planning, to imagine the different ways that an emergency may unfold or a crisis may unfold, and the process that should be followed to support a student in crisis, which again may include recommending the 988 Lifeline as a source of support. In step five, the team develops the basic plan and formats the annexes and reviews all the sections. And after the plan is reviewed by leadership, the team can decide which portions of the plan they'll share with community partners. And the mental health collaboration team can really help those education leaders understand and develop protocols and laws around information sharing. Finally, the planning team needs to implement the EOP. This means providing the whole school community with training and opportunities to practice the plan. Mental health staff can attend and even lead trainings and/or participate in and observe exercises. They can also ensure that exercises are using a trauma-informed approach and that they are aware of the available resources such as 988 and how they can use them in collaboration with partners both within and outside of the school building. So as members of the core planning team, mental health collaboration staff will be able to revisions to and overall maintenance of the EOP after an event, because EOPs are living and breathing documents. They don't sit on the shelf. You have to constantly review them and revise them based on lessons learned during emergencies that take place and/or during your efforts to practice the plan. And this is really how the planning team kind of closes that continual loop and ensure that the plan evolves to meet the needs of the entire school community. I am so happy to introduce our next guest, who will provide an overview of the 988 Suicide and Crisis Lifeline. Monica Johnson is the director of the 988 and Behavioral Health Crisis Coordinating Office. Ms. Johnson has worked in the behavioral health field for more than 26 years and most recently served as the interim commissioner for the Georgia Department of Behavioral Health and Developmental Disabilities. Prior to this role, she served as the Division Director for the Division of Behavioral Health for 8 years and the Community Mental Health Director for 3 years, and the Child and Adolescent Mental Health Director for 1 year. So we're so happy to have you here, Monica, to share your expertise. And with that, I'll turn things over to you.
Thank you, Janelle. Thank you for this opportunity, this partnership to the Department of Education. I am thrilled to be here today. As you referenced in my introduction, I came to the department. I've been here for a year now to SAMHSA, and I'll say a little bit more about that in a second. I've been here for a year, and prior to that, I came out of state government from the state of Georgia. I spent 12 years in state government. We work very closely with our local Department of Education. And prior to that, I spent many, many years in community-based settings. I started out my 27-year career in behavioral health in the child and adolescent world. And so I have a lot of direct experience from being in the community, working with schools, and then the most valuable experience that I like to remind people of is being a parent. And so I am a mother of children who are now not children, but young adults, 18 and 21 years old. And so children's behavioral health has always been just an important part of the work for me. And you cannot address behavioral health issues without talking about how do you work with children and families, because guess what? People don't just appear as adults at 22 and just show up. They start out as children and they come with a unit and they are a part of a family. So I just like to give a little bit of insight into who I am. All right, so today I'm going to focus on providing an overview for what 988 is. And hopefully this will help you all participating. I saw the poll, it's a good mix of participants here, but saw a lot of school social workers, school counselors, etc. So hopefully this will be information that can help everyone, including the people listening, for their own personal lives. And so I think it's going to be good information. We will talk about how you can help raise awareness, which I will keep hampering on throughout this discussion today. Next slide. So I indicated that I have been with SAMHSA. SAMHSA stands for the Substance Abuse and Mental Health Administration, part of the United States Health and Human Services Department. We are the entity that is charged with leading public health efforts to advance the behavioral health of the nation and to improve the lives of individuals that are living with mental health or substance use disorders. During my presentation today, I may use the word behavioral health interchangeably. And when I just wanted to do a disclaimer, when I say behavioral health, I'm including all the things. I'm including mental health, everything that comes under that umbrella, but I'm also talking about substance misuse as well when I'm saying behavioral health. Our mission is here and our vision is also outlined here for your reference. Next slide. So if we were in person, this is the first question I would ask. So we're going to do a poll in this venue. I would like to know how many of you have before seeing this announcement, knew what 988. Oh, this poll is moving fast. So we're about to find out how aware is the audience. So I'll give folks a second to, oh, this is fascinating. So we'll give folks. So far, it looks like what is leading is I was somewhat familiar with 988. I appreciate the honesty of the 13%. I have never heard of it. I think the 23% and the 13% of I've never heard of it, I've heard of it, but don't know much about it, is probably where most people sit. So that is okay. And then the very familiar with it, 28%. Interesting. All right, it looks like everybody's answered this. So I'm assuming, I think you all can see the results. This is fascinating. This is pretty much, I would say, what happens when I ask this question everywhere I go. The majority have not heard of it, or they've heard of it but don't know a lot about it. And then even those that are somewhat familiar tend to walk away saying, gosh, I learned a whole lot that I didn't know today. So that's interesting. Thank you for doing that. And hopefully today you will walk away not only knowing more about it, but also how to share and make sure that other people know what you know as well. All right, so next slide. All right, so I'll start with doing a general overview of what 988 is. For those that say they're super familiar with it, well, stay with me and hopefully there'll be something here of interest for you as well. So if we go to the next slide. So as of July 16th, to be exact, 2022, 988 became the new and easier way to reach what was formerly the National Suicide Prevention 10-digit hotline number. So prior to July 16th, there was a 10-digit number that solely focused on suicide prevention. What happened July 16th, 2022 is a 3-digit, much easier number became law. So that no matter where you were in this country or where you are in this country, any U.S. territory, any tribal nation community, that you are able to dial 988 to be connected to a trained crisis counselor. So it is not new, the concept of the number. It is now, what is new is the 3-digit part. And it is more expansive than focusing primarily only on suicide prevention. So it is now called the 988 Suicide and Crisis Lifeline. And we all know, particularly this audience, that crisis means different things to different people. You don't have to be experiencing a crisis that is related to suicide in order to use the Lifeline. I think that is one of the biggest misconceptions that probably exists because it was a transition from the 10-digit number. So whether you're experiencing any type of emotional distress, or you are helping a loved one who is in some form of behavioral health distress, or you're concerned about your or someone else's drug or alcohol use, an individual having thoughts about self-harm or other upsetting thoughts, you can call, text, or chat 988 anytime, 24/7, 365 days out of the year. You don't have to say who you are. You can remain confidential when you contact or when anyone contacts 988 in order to receive support and services via the Lifeline. It is obviously a much simpler way to get connected to help for either yourself or someone that is experiencing any type of distress than trying to remember a 10-digit number. In the same way that we all know what 911 is, and I will talk about the difference between what 988 and 911 is, but we, just like a 3-year-old, a 4-year-old, sometimes even younger, knows what to do and knows how to call 911. When we are all probably gone from this earth, 988 will become that. It will take time for this to become, as you know, a household name, just like 911 is, but we are at the beginning stages of what is going to be huge transition or transformation for the way we handle people when they are experiencing a behavioral health crisis in this country. Again, it is free. And there are multiple ways to access it. Again, you can call it, you can text it, or you can chat. The services that are offered through 988 have continued to expand over time. We now have expanded our access to include services for veterans, Spanish individuals that are Spanish speaking, LGBTQI+ populations, and deaf and hard of hearing people. And translation service enables us to communicate in 240 additional languages. Next slide, please. So what happens when you contact 988? Many people ask this question, and it's a legitimate question. Contacts are answered by a network of over 200 local crisis centers across the United States. It's important to note that these contact centers existed prior to the launch of 988. And so again, this is the evolution of the system that already was there before, but just the evolution of that. And so when an individual reaches out to 988 based on your area code, you would be routed to a crisis contact center that is closest to you. Counselors who work at these local centers are well trained to answer and support and provide support. 988 counselors, first and foremost, listen to the person and understand where they're coming from, try to assess what the needs are, what the resource needs may be, what other connections may need to happen to help support that individual. They can offer various types of support depending on what the person needs and what they want. It might be providing local resources, referrals or connections to help maybe to create a safety plan, to seek ongoing treatment, care, or support. But many times it's just listening. So I think that's important. Many people assume that if you call the number that all these other things have to happen. In many, many instances, people just need to feel connected. They may need resources, but that feeling of I'm being heard, I have someone to talk to in this moment where I don't know where to begin, I don't know where to start, is really important. The most important aspect of this really just boils down to the human connection. Counselors do need to assess safety and ask a few specific questions to make sure that the person isn't in an emergency situation, but their main focus is on having a conversation to meet the person where they are. The care provided is centered around the needs of that person. It is meant to be person-centric. So counselors also ask some questions to find out what the person needs beyond the conversation, if anything. Many people don't want or need additional services or resources at that time, which is fine. You don't have to say who you are. You don't have to disclose anything you don't want disclosed in order to receive support through the 988 Lifeline. The counselor may, though, ask for general location in order to provide local resources. So that should make sense for you. A small percentage of contacts do require emergency services like 911 or EMS, for example, because there is an active suicide attempt in progress or other imminent risk to the person's life. But the vast majority of people in crisis, the conversation and resources provided are successful in de-escalating the crisis. So emergency services are not needed in those scenarios. If emergency services are contacted, in most cases, it will be done with the person's consent. Next slide. So how does it work? So you see here a diagram to give a very simplistic way to show you what happens overall with the flow. So when someone calls, they're given a choice to connect directly to the Veterans Crisis Line. This is a very key partnership that we have so that those individuals can be connected and transferred to the VCL, the Veterans Crisis Line, which is run through the Veterans Administration. They can also connect to Spanish or LGBTQI specific sub networks. They can remain on the line, or they can press 0 to be connected to a caring counselor at a local crisis center who is able to provide resources nearby the caller. If the first center is busy, the call would then be routed to a counselor at a state or a national backup center. Texting and chatting options are growing in demand, as you can imagine, especially texting, and are especially important to reach our youth. Deaf and hard of hearing people can also call 988 on a video phone if ASL is their preferred mode of communication, or they can go to 988lifeline.org and select ASL now. For any of these services, people can contact 988 for themselves. And again, if they are just simply worried about someone else, they can make that call as well. Next slide, please. So this list is not meant to be all exhaustive, but it really talks about reasons for someone to contact 988. These are just some examples. Again, thoughts of suicide, concerns around alcohol use or drug misuse, anxiety, sexual orientation, feeling depressed, mental or physical illness, loneliness, trauma, relationship concerns, economic worries. The list is endless. What I say to people when they ask, should I call 988? It doesn't hurt. It doesn't hurt anything if you do, right? So if you feel in any way, when I say the word crisis, it means something different for everybody. And so if it feels like a crisis for that individual, it doesn't have to match the next person's crisis or their definition, then you can reach out to 988. It is a way to divert individuals away from calling 911. It is not a replacement of 911. 911, it is emergency public safety at-risk situation. And so it is 988 does not replace that. And so what 988 does, though, is we know that individuals, because we're programmed this way, we're trained to call 911 for anything. And we want people that are experiencing any type of behavioral health distress to be able to get the right type of response. And that is not often a police response. And police will tell you this too. This is not what they want to be doing. We want trained individuals to be able to provide the support. And if an intervention is required, and I'll talk a little about this in a second, then that right intervention happens. All right, next slide, please. 988 is proven to work, and it helps thousands of people every day. I get the honor to go around this country and look at and hear stories and see how and talk to people and understand how 988 is playing out in communities all across this country. And what I do know is that I hear constant feedback. I get to hear success stories. I get to hear people say, you know what, I actually work in this field and I had to call 988 because I experienced a loss and I couldn't get past it. 988 does help. These lifelines do help people. Research has shown this to be true, that after speaking with a skilled, compassionate counselor from 988, most people who contact 988 are significantly more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful. The research backs this. Next slide, please. So 988 is a catalyst. As I'm gonna trademark that because I say it all the time. It is a catalyst. It is a moment in time that shame on us if we do not take the opportunity to look at how do we transform the behavioral health crisis system as a whole, which leads to a bigger conversation about access to behavioral health, period. But this is the catalyst. This is a moment. I have been doing this work my whole adult life. And this is the most transformative thing that I have ever seen happen in behavioral health care. It is now giving us an opportunity. Every state, every territory, every tribal community is having a conversation about their crisis systems because of 988. Because 988 is saying, hey, we want to have a way for people to reach out when they are in need. But then we got to talk about, well, then what does the crisis system look like? What happens beyond the call? I have never seen this type of activity where without a lawsuit, without something forcing states to sit back and say, let's look at how we deliver behavioral health crisis in our states as a system. So 988 is a catalyst, and it is the beginning of behavioral health transformation. So 988 is a three-leg pillar. There are three parts to this system. What I just spent time talking about was the someone to talk to. But there are two more additional pieces. There is someone to respond. That may look like a mobile crisis team. It may look like different things depending on where you live and what's available in the state, but that is one example. And it may also look like a safe place to receive help for those that need something beyond the call. So again, us transitioning to this system, implementing this new 3-digit number is the beginning of transforming behavioral health crisis systems. Next slide, please. We have never seen this type of investment in behavioral health crisis services. It has been unprecedented amount of investment from the Biden-Harris administration. It is one of maybe a handful of initiatives that receive bipartisan support because it transcends a whole bunch of lines that separate people. This is about all of us, not some of us. And I think that's important when we're talking about behavioral health care. This is not a conversation about a group of people over here. It is about all of us. And if you needed an example to demonstrate that, just think about how you as an individual was feeling in 2020, probably around March when the pandemic really began, how your lives began to be different, how everything changed. So when people say this conversation is about a group of people that's not applicable to me, I think we're at a moment in time where we realize that not only is it about all of us, but we need to be really invested in how we come together as communities to build out what we want for our system to be and what we want for our families. So this is about transforming crisis care together. To truly transform crisis care across the country, it's going to take the voices and the expertise of everyone. That means people with lived experience. That means the parents. That means the experts. That means everybody that's involved in this ecosystem that you can see represented here. This is a comprehensive collaboration. I heard conversation earlier in the presentation about how do you effectively collaborate, but this requires emergency services and crisis supports working together. Service organizations like the veteran service organizations, consumer and family organizations, healthcare, behavioral healthcare providers, including health plans. Who pays for this? How do you pay for this? How do you sustain this? So policymakers, government officials, courts, schools, community organizations that educate, engage, and support youth, adults, and families, peers, family, all of the above, faith communities, and so forth. It's the biggest group project that I think I've ever been a part of. Next slide, please. So let's spend a little bit of time talking about the resources that are available to help us, help you be able to share more information about what 988 is. So you can find additional information on materials on the SAMHSA's 988 Lifeline website. I encourage you to go to this page, bookmark it. I have it bookmarked. I go to it often to share information to people that I know. So what you see on the left is that you see the website link there, the FAQs, performance metrics. If there's data out there, you can see kind of the volume of the calls that are coming in, etc. There's a partner toolkit, a resource library. There's print and digital marketing materials that you can download and use to help get the information out about 988. There's a second public website, 988lifeline.org. That's on the right of the slide. That is designed for people that are in distress and for those trying to help someone in distress. It enables visitors to connect directly to 988 services, including the 988 chat option. So please take a moment to go to both of those and bookmark them, please. Next slide. You can find materials. I think I may have mentioned earlier that one of our key resources is our partner library. The partner library is now searchable, which is exciting for us. This was very good work done by our team to make this just easier to filter down to what may be most important for the individual seeking out information. So on the left side of the screen, you can see that there are filters that allow you to search based on a specific audience, population, looking for resources that may be English, Spanish, ASL, what type of resource you're looking for, like a fact sheet, video, print material, etc. To find materials that are relevant to schools, you can use the target audience filter and check school employees. Other potentially helpful audience filters include counselors, parents, families, caregivers, and higher education. The population filters allow you to find information for specific demographic groups, rural populations, LGBTQIA+, and deaf and hard of hearing individuals. Again, you can bookmark all of these things so that this can be, you can get to it pretty easily. And you don't have to figure out every time how to do that. All right. Next slide. This is just a sample of some of the materials that are available in the partner toolkit. Again, these are things that you can get access to You can post them in your offices, in your schools, in your home, on your refrigerator, wherever. If you'd like to sign up, next slide, please. If you'd like to sign up for information to be able to get email updates, you can do so. You can get our email newsletters. It provides monthly updates about 988's communication work, partner resources, and more. All right, next slide, please. All right, so, and you go to the next slide. So as we think about particularly schools and your work with 988 and resources that may be important for you, one potential first step is to explore partnerships in your area is to contact the 988 Crisis Center near you. So if you are in a state and you're not clear who the Crisis Contact Center is that receives the 988 calls, I think that will be an important first step to know who are the local contact centers. That's really important to know, and establish some partnerships with those entities directly. There are several ways 988 crisis centers could be helpful for you. Some of these ways, this is not exhaustive, but just to give a couple of examples, many 988 centers are publicizing 988. They may have localized educational materials about 988 that you can use. So if you just partner with them, you probably can get access to things that will be helpful for you. They may be sharing posts on social media that you can reshare at school, in the school district, or on personal social media accounts. The crisis contact centers may also be able to connect you with other educational partners or community organizations that exist at the local, district, or state levels that are interested in 988. So you can share ideas for publicizing 988, or perhaps create materials that you'll use, and you can maybe share some of those printing costs. So if you're looking for the 988 center nearest you, you can visit the Our Network page on the 988lifeline.org. If you scroll down to the map, search by your zip code. If there are a few centers near you, you can contact them and ask if their school is located in their 988 coverage area. And I think the slides are off. Next slide. Oh, wait, go back. Can you go back one? I'm sorry. I think I skipped one. Yeah, so this is important. So I want to make sure that you guys know how you can raise awareness of 988 as a resource. Just want to make sure, this is going to come up some more on the panel today, but here are some initial thoughts of how you can do some of that work. Again, I recommend that you visit the SAMHSA 988 page. It is updated very often. Familiarize yourself with the FAQs, as well as the partner toolkit, so that you can answer questions about 988. You'll know what materials are available. Second, you may want to think about potential opportunities to mention 988 as a resource to students, as well as to parents, as well as to employees, to coworkers, etc. And then third, I've listed several ways to use the partner toolkit and materials, and how you can use that to let people know about 988. Using the posters, using social media, stickers, school IDs, etc. There are so many creative ways that you all could think of beyond that, in ways in which you can access materials. Using QR codes is a very common one that we see. Thinking about how you can communicate with parents and staff members, for example, maybe through school newsletters, at school meetings, resource listings, etc. There are many ideas out there, and we'll get to hear more about that as this webinar continues, but hopefully that got kind of your brain churning a little bit, because we do want to hear from you on how to educate about 988. All right. So now we can skip that one. So with that, I am done with my presentation. I know that there's questions. I think we'll do that at the end. I will stick around for the whole presentation. And at this point, I turn it back over to Janelle. Thank you for your attention and time.
Thank you so much, Monica, for the wealth of information that you shared. And just by looking at some of the questions that came in, you answered many of them. But I am happy to turn things over now to Linda Langford, who will moderate our panel. Linda, over to you.
Great. Thanks so much, Janelle. My name is Linda Langford. I'm from Education Development Center, and I work with a team headed by JPA Health to provide support to the 988 Communications Office. So it's my great pleasure to welcome our three panelists and invite them to share their unique perspectives about 988 and how 988 can be a helpful resource in school communities. Our three panelists today are Yashi Duhan, who works as a 988 counselor, Lisa Kaposha, who's a school social worker and school adjustment counselor at a middle school, and Addison Agabine, a teen who will share some of her experiences with mental health concerns and seeking support. So I'll give a fuller introduction for each panelist as I kick off my conversation with them. And this part of the webinar really is a conversation. So if we could stop the slides now, and I will introduce Yashi. So Yashi Duhan is a qualified mental health professional with 5 years of experience in helping individuals navigate life's challenges. Yashi has spent the last 4.5 years working at Travis County Integral Care as a trained crisis counselor with their local crisis hotline and the 988 Suicide and Crisis Lifeline. She spent the first 2.5 years answering crisis calls before being promoted to team lead. Yashi believes in a collaborative approach, working together with those who contact 988 to develop personalized strategies for growth and healing. Thank you so much for being here and welcome, Yashi.
Thank you so much for having me, Linda.
So you're really bringing our, what it looks like on the inside, answering 988. So as somebody who answers 988, can you talk more about how people can access this resource?
Of course. So as stated before by Monica, you can pick up your phone and dial 988 and get connected to a 988 counselor via voice or via phone. You also have the option to, from a cell phone to text. So just simply send a text message to 988 and you would be connected with a crisis counselor there. Or if you have access to chat, and I make that distinction because some people, if they don't have like maybe service where they are, as long as they have a connection to a Wi-Fi, they can access the chat, and that is found on the 988lifeline.org website.
That's wonderful. And so who answers 988 and how are they trained? What does that look like to get ready to answer 988?
The 988 Lifeline is staffed by clinicians who have been trained, extensive training, and answering Lifeline support calls or chat or text. And it's just a group of clinicians who have at least a bachelor's degree in social services or mental health, the mental health field. They also receive additional training once they're hired, and we put them through a pretty rigorous 8-week training after they arrive. And then they have a practicum that is them taking calls monitored by supervisors. So very well trained clinicians who are there to just listen and provide as much support as they can.
Great. And when you say clinicians, not everybody is a trained therapist, right? But everybody's a trained helper for 988. Is that correct?
Correct. So there is a difference between our crisis counselors, clinicians. I go back and forth in those terms, and say like a therapist or a school counselor, as they are not required to have any additional training, education outside of their bachelor's degree, and they are not licensed like counselors and therapists, but they do go through extensive training to be able to answer those Lifeline calls.
Great, terrific. That's helpful. And what are some of the things that happen when people contact 988? What is that experience like from the caller's perspective? What might they expect?
What can be expected is to find support. When you're having a mental health crisis, we get people sometimes in their most vulnerable times. And so we want to make sure that we are listening ear and that we provide an empathetic, safe space for people to discuss what's going on with them, caring conversation. I think Monica mentioned earlier that before there was the belief that it was only if you were experiencing thoughts of suicide. And we want to make it very clear that although, yes, we do provide services for people who are experiencing suicidal thoughts or homicidal thoughts, we also are there to just provide a listening ear for anyone who may be having a mental health crisis or going through a tough time, experiencing anxiety around school, around personal things, whatever it is that you need when it comes to needing support around your mental health. So it does not specifically have to be just suicide. Just if you need any type of support, there will be someone there to listen and provide that support for you.
That's wonderful. So it sounds like people call with a lot of different types of emotional distress. Like it can be really about anything. Is that right?
Correct. We have people who call because they had a rough day at work or a rough day at school, or they've lost someone recently, or even lost a pet. People who are distressed about world events, or just something as simple as having a disagreement with one of their friends and they're upset about it, and we're there to provide support for them.
That is wonderful. Thank you so much. So we really appreciate you being here. We'll probably come back to you in a few minutes, but it's so helpful to have that insider view of what it's like to answer 988 and what that experience is like. So now let me turn to Lisa. Lisa Kaposha works as a school social worker and adjustment counselor at the Oak Hill Middle School, which is a public school in Newton, Massachusetts. In this role, she provides school-based counseling to students with a range of social and emotional needs and diagnoses. She facilitates linkages to community resources for students and their caregivers and collaborates with other adults in their lives, including caregivers, other educators, and outside providers. Before Lisa worked in school mental health, I had the pleasure of working with her at the Suicide Prevention Resource Center, which is a national center that, like 988, is also funded by SAMHSA. Great to see you again, and welcome, Lisa.
Thanks, Linda.
So, you're sort of bringing our school perspective, and how does 988 intersect with schools? So what are you seeing in schools around mental health that indicates a need for mental health supports?
Sure. And a lot of what Yashi just shared that she hears from folks on the other line is a lot of what I'm seeing during my school day hours. So I work in a middle school with 6th, 7th, and 8th graders, over 600 students. And I see students presenting with anxiety, depression, symptoms of ADHD that may or may not be treated, and that can compound with anxiety or depression or trauma, self-harm, low self-esteem. And so we're seeing these symptoms of these conditions in more acute states than I think I did 5 years ago. Earlier in the year, we're seeing these, and there's 50% of people on this webinar who are in the same role as me. So I'm sure they're seeing a lot of the same things too. And we're also seeing fewer supports out in the community in terms of wait lists for outpatient setting, outpatient mental health services to be able to support them. So the setting that we're in a school is not meant to be therapeutic, but it ends up being a place where we're having a lot of students spend time. What that can kind of look like is that students might not stay in class for the full period. They have school avoidance. They may have difficulty concentrating. They might need to process a difficult interaction and just can't quite get back to learning or concentrating until they can kind of get that out of their system. And like I said, the topics, Yashi mentioned losses, moves from a different community, move to a different school, friendships, anxiety around performance. Maybe they had a bad night at home with a family member and they can't quite get on track until they kind of get that out of their system. So, and then in terms of suicide risk, we see students all along the spectrum from passive, kind of low risk ideation to high risk crises. And sometimes we're very aware of that risk among a student group. And sometimes we discover it kind of very quickly. And so those are some of the different types of situations that we respond to.
Great, that's super helpful. Again, we're sort of looking for how does this all look on the ground. So having that school perspective is really useful. What are some real world examples of how you use 988 in your work?
So there's a few. In my school and in my district, we do the Signs of Suicide, suicide prevention program for all 7th graders. And so when we are presenting the classroom portion, the education portion of that program, we make sure that students understand that 988 is a resource available to them, because we're trying to teach them to recognize distress in others or in themselves, and different ways they can get help, including seeking help from an adult, but also if an adult's not available in that moment, that 988 is a resource. Also with SOS, when students screen positive after the education portion, when we have one-on-one conversations with students that screen positive, 988 comes into conversation around resources that they can use. Just kind of help, something that could maybe help them figure out what to do next. In my role as a school social worker, I provide individual counseling to students who have special ed plans and gen ed students as well. And whenever there's a student who is in crisis or who is at risk of having suicide crisis, we develop safety plans with them, and 988 is always part of that safety plan. And then the third area is caregiver support. So caregivers are often not necessarily in the same place as either the student or the school on their education around what this is the nature of suicide risk and what kinds of supports can help suicide risk. And that just because you utter the word suicide doesn't mean a trip to the emergency room. And so we do a lot of educating with caregivers around 988 as an adjunct resource. Sometimes they don't have mental health supports in the community available. Wait lists are 3 to 4 months long. If we're lucky, sometimes it's even longer. And so making sure people know how to access supports in those after school hours and those evening hours that can become very stressful is another way we use it in my work. And then also families sometimes, for caregivers themselves, just managing the stress of parenting a student with a mental health need, managing the stress of their own mental health need, or just a situation that might feel unsafe and they're reluctant to call a mobile crisis number. 988 is a resource that we give them.
Yeah, I think that's a great reminder that 988 isn't just for the students. It's for caregivers. It's for school staff. You know, it's for anybody who might need support around their mental health challenges or emotional distress. So thank you for that. What are some other ways that students can spread the word about 988 besides the sort of direct ways you just talked about using it in, your work with individual students?
Sure. So we emphasize to students getting support from an adult if they're concerned about themselves or anyone else. And so in a school community, there are many adults that could, and it really is sort of up to that student to determine with our help who a trusted adult is to them. It might be the librarian, it might be an athletic coach. It might be nurses. Nurses are definitely partners in this work for communicating about 988. I'm part of an emergency response team. So like I learned something from this webinar as well about how I can go back and communicate with my team about this resource and how we can use it beyond my role and my mental health team's role. There are faculty who lead clubs. They get to see students at the end of the day in a different kind of setting. And there's places we can put literature. And I just wanted to mention one other thing is that in my school, we have a very diverse culturally and ethnically and racially, and students from all over the world in my building. And so culturally, there are many families who are not comfortable with traditional mental health services. And so even if they have access to outside mental health care, they're not always ready to take that step. And so 988 is a great resource that we can help with folks who are just dealing with not being able to accept that quite yet.
Great. That's extremely helpful. Thank you so much, Lisa. It's so great to have your school perspective and kind of hear how people can use and share 988 on the ground. Okay, and we will come back to you in a few minutes as well. Now I'd like to welcome Addison. Addison Eggebeen is a 14-year-old young woman who was born and raised in Nashville, Tennessee, and is currently a freshman at Hume-Fogg Academic Magnet High School. Having struggled with her own mental health concerns at points throughout her life, Addison is an advocate for breaking down the stigma related to talking about our mental health, asking for help, and hopes to continue to raise awareness around suicide prevention and mental health. Welcome, Addison. We're so pleased to have you today.
Hi, thank you for having me.
So I know that you have used 988 in the past. Can you talk about what was going on that led you to want to use 988?
So it had always been something that my mom and I had talked about, but my mom is a social worker and has been since I was a baby. So I have kind of grown up in more of a like mental health inclusive environment. So it was always something that we had talked about, but I had never talked about using it. But then I one day asked my mom, like, hey, if you aren't here for me to talk to, what should I do? And so then we talked about that, and she was like, oh, you can text or call 988. And so I ended up doing that like about a week later, because I was at home by myself. I just not had a very good day. And I would, most of the time, whenever I would contact 988, it would be that I was feeling overwhelmed with my emotions. And we would kind of talk through, okay, how can I calm down right now and figure out what to do next? And then we would figure out, or they would help me figure out how to tell like a family member or one of my friends or just someone trusted that I can talk to.
Yeah, that's great. I just love the idea that that was sort of in the moment resource and that your mom had told you about that. And so you sort of alluded to this a little bit, but what was it like when you contacted 988? What was that interaction like?
So I've both called and texted 988, but I would say whenever I would call it, it would be more of like I need someone to physically talk to as if they were in the room with me. So I would call them and they would help me with things. It would typically be like breathing techniques at first. And so it would help me calm down so that I am aware of what I'm talking about and so that my train of thought would be focused on what I specifically was dealing with in that moment. And then we would figure out like, okay, when are your parents going to be coming home? Or when are you going to be seeing someone next? Or like just what the rest of my day would be looking like. And then what my long-term plan would be in terms of keeping myself safe.
That's great. And how was it helpful to get that support? What were some of the things that you were able to kind of do beyond the moment with that support?
So it in the long term or in the long run, it helped me talk to my parents and get help both in school and out of school. Like I got in contact with my school counselor and I started going to therapy because we realized that there was something deeper than just like, oh, having a bad day. And so it helped me become more self-aware and realize more what like I needed to keep myself safe.
Yeah, that's wonderful. I just love that you're describing, sort of how it helped you right in that moment and then kind of what else you were able to do after with that support. So thank you so much for that. Again, we're going to come back to questions for all the panelists, but Addison, I just really want to extend a special thank you to you. We're just so appreciative of your willingness to share your story. And I know what you're sharing today will help many, many people to support young people more effectively. So we just really appreciate that. And you're getting a lot of hearts as well, you should. So I'd like to bring back all the panelists now and ask all of you, and this doesn't have to go in any particular order, and we can kind of popcorn it around a little bit. So for all of you, what advice do you have for educators and their partners who are sharing 988 as a resource? What would you recommend to them?
I can go first.
Okay.
As a call taker and as someone who works for 988 answering calls, I would suggest one of the questions there was concern about when to use us. If you ever need any support, just use us. If it turns into something where we need more immediate support, like 911 or something, we will get you to that resource. So definitely just feel free to use us for anything. There isn't a wrong way to do it. Just get the help that you need. And so that requires you to call us, and we need to connect you to someone else in order to get more hands-on support. Then do that. It's never a thing where you're bothering us or you're misusing this service. Just call us and allow us to assist you and support you the best we can.
Great. I think that's a great message to communicate to the community. Addison or Lisa?
Sure, I can. I think just encouraging people to try it out if they're not sure what to find out, like firsthand, what the experience is. Emphasizing that it's a caring conversation and reminding people that it's a safe space. I think some of the parents in my community could be barriers, caregivers could be barriers for a student to use it if they're concerned about, their young person talking to a quote stranger. And so having an endorsement from the school mental health team saying, no, this is a safe resource, people are trained. And then for students who do choose to use it independently, just reminding them that it is confidential and that it's a safe space for them in a different kind of way. So all of those reminders.
I would also like to add on that specifically from like a student standpoint, talking to people that I go to school with or like my friends, a lot of the time it's that they are scared that like their family will find out that they contacted or like that someone would like show up. And so I would think that making it as clear as possible that it's a preventative support hotline and not like, okay, only if you think that like right now something bad is going to happen, but like it's more to prevent that crisis from happening. And that it's as anonymous as the person who is contacting it wants it to be. And I just know that from personal experience, that's what I was afraid of.
Great. That's really good insight. Thank you. And so before we go to Q&A, I just want to give all of you a chance. Is there anything else that you'd like to say to the participants today? Any final words? And it's okay if you don't. I mean, what you all have shared is just incredibly valuable. Just thank you for each of you, Yashi, Lisa, Addison, for being here, for being willing to share your incredible experience and expertise with us. I think this will really help people understand 988 at a different level. So just appreciate you all being here. And now I'd like to turn it over to Stacy, who will moderate some questions and answers.
Hi, everyone. And again, thank you to all three of our panelists for their wonderful perspectives. Before I start with questions, I actually want to just read something that came into the Q&A so Addison hears it live, which is, I know this is for questions, but I just want to thank Addison for being willing to talk about her experience with 988. You are amazing. I think everyone here, that's why you're seeing all of these hearts. So first off, I'd like to push a question to Monica, which is, how does 988 work with other elements of a community-based crisis system?
Yeah, so 988, like I said earlier, is step one. So 988 is getting access to the contact center. If an individual, I loved the way Addison talked about her experience, because that is how most experiences take place, that they get what they need in terms of a preventative, supportive space. For individuals that need more than that beyond the contact, then this is the part about having a infrastructure in place where a response can be provided. And so in many instances, that may look like a behavioral health mobile crisis team. Mobile crisis teams look different depending on where you live, states, et cetera. But typically a mobile crisis team consists of a clinician, perhaps a peer, or other paraprofessional role like a case manager. And that mobile crisis team can show up in the community typically with the, it's not like a surprise visit. It is with the coordination and consent with the individual that is needing that type of support that needs to happen in person with more of a clinical lens. Mobile crisis teams can often appear in schools, in homes, wherever that coordination effort needs to happen. And then the third pillar, of course, is for individuals who need stabilization support services or treatment. And so there's a plethora of types of services that can fall into that category. But the premise is that there is a place to call or contact, and then there is a place for a response to be received if that is what is warranted, and then a place for treatment and stabilization as the third final pillar.
Thanks, Monica. So next question is for Addison. And the question is about how to help school staff and students be less timid and not second guessing calling or texting or chatting for help.
I would say kind of what I said earlier about just making it known that it's as anonymous as the person contacting it wants it to be. Because that's a lot of the time what people are, especially kids, are afraid of, is that other people are going to find out that they are struggling. So I would say just making that known and making it known that it is best to be used in early stages of like realizing you will need help in the future, like realizing beforehand instead of letting it get all the way to the crisis.
Thanks, Addison. So this next question is, I'm going to combine a couple of questions for Yashi from your call center experience. There's some questions around if there are limits to the amount of times a person can use the service. Is it okay to try 98 with a student to help them get familiar? Are you able to answer that from your
Yes, I am.
lens?
So we do not have a limit on the number of calls that a person can call to 988. If you need the support, definitely just reach out. And as far as calling to see how the service works, we've had counselors do it before. We've had counselors say, I want to disclose this to our students in a assembly that we're having today, and I wanted to see how it works. So they call in themselves to see how it works or how they can get in contact with someone or who answers. And then sometimes they've done it with the student there who is reaching out for assistance, say with the school social worker or the school counselor, and they call from their office. And so the counselor's with them to help them get started, and then they leave them there for us to speak to them. So yes, absolutely, you can call to see how the service works and make sure that they're familiar with it, or make sure that you yourself are familiar with it. So when you give the information to the student, you can answer any follow-up questions that they may have. And no, there's not a limit on the number of times that you can.
Thanks so much, Yashi. Monica, there's a lot of questions that come in around how 988 partners with law enforcement. I know you talked a little bit in your presentation about that, but can you dive deeper into that, that interaction?
Sure, absolutely. So this looks different in different places. And so I want to reiterate the importance of connecting and understanding what happens locally with the contact centers in your state, as well as the behavioral health authorities that are in different states and in different counties, different areas, because the variability will exist. But at a federal lens, what we are expecting is that there is coordination between 988 and 911. I had referenced earlier that we want individuals to be diverted away from 911 if there is not a public safety emergency. And so we have a history in the behavioral health field of somewhat criminalizing what looks like a mental health or substance misuse issue. And so we want to make sure that where we can, that we are collaborating. We expect that behavioral health authorities, contact centers, law enforcement, that these individuals are around a table having conversations about how to truly implement this vision in their localities, because everything does not look the same everywhere and every resource is not the same everywhere. But it's just really important that that happens. There are some innovative practices out there where we know for sure that people are still going to call 911. It is going to take some time before this is really baked into the cake, for lack of a better way to say it. And so people are going to call 911 for things that could have been diverted to 988. And so where that happens, it's important that law enforcement communities understand what 988 is and that they can make those connections in the reverse. Or if they have to respond to a situation, that they have some response that looks like, I'm going to use the term co-responder model, which looks like when police do go out, for instances, that they take a trained behavioral health professional that can provide the appropriate intervention versus what would happen without that expertise present.
Thanks, Monica. So another theme that's arising in the questions revolves around mandatory reporting and children of different ages, people calling from schools. Who do you talk to? Can you talk a little bit about mandatory reporting?
Sure. So first of all, mandatory reporting laws are, based on what state you are in. So I want to separate, though, for the purpose of this conversation, treatment versus contacting a hotline. So contacting a hotline for support may be very different than having to get consent for treatment. And so while consent for treatment is not what is happening when you contact 988 for what Addison described, versus we now need to provide treatment, or the person is entering treatment, like when I talked about a place for help. So that would include like a crisis stabilization program. So that's treatment. And so that's where that will come into play. But I would encourage individuals, again, to make sure they understand their local and state laws as it relates to mandatory reporting, because it may look different in different places, and you should adhere to the local laws that exist.
Thanks, Monica. And our next question is for Lisa. There's a question about what curriculum you're using to teach signs of suicide.
So the curriculum is actually called Signs of Suicide, and my district chose it before I started working there, but we use that as one specific universal intervention with 7th graders. So every year we designate a week where we go into their classrooms and we roll out the education portion, and then we have a screening questionnaire that goes with it that's part of the curriculum. And the education portion is a video and a Q&A and a discussion, and all of our staff, our counselors who I work closely with, are all trained to deliver this. And when we do the screening, then we identify students who are high risk, and we have a whole protocol for meeting with them. But we also have other suicide prevention approaches in the building outside of that are more tier 1 or tier 2 or tier 3, depending on the needs. So some of that's how we communicate with our mobile crisis organization, how we communicate with parents, what types of risk assessment tools we use, and other pieces of a comprehensive suicide prevention strategy. But I see 988 as definitely a piece of that that we add on ourselves.
Thanks, Lisa. And then I'll just respond to one last question that I see in the QA, and I think then we will hand it back over to Janelle. So Shauna is asking about and I'll handle this one. But Sean is asking about if there is a YouTube video or some other video that is geared to middle and high school students that could be shared with them, providing an overview, perhaps a visual of the call center questions, typical interventions, and what to expect after. Fantastic question, and these are the kinds of things we want to hear from you. Is what do you as professionals working with students, with schools, think that we need to create more of? So I encourage you to start with the partner toolkit that Monica referenced earlier. See what is there. We have a large number of videos and social media posts that you can start with. And then we want to hear from you about other things that you think would be really useful. So we appreciate that suggestion. Thank you so much.
Well, thank you so much to Stacy and Linda, to Monica and Ruth, and to each of our panelists for all that you shared today. I'd also like to thank our webinar participants for posing such great questions. We are grateful for the resources that Monica shared throughout her presentation, and you likely saw that we shared additional links throughout the event. We do want to take a moment to just highlight a few additional resources from the REMS-TA Center that may be helpful as you explore ways to support students and educators with preventing, responding to, and recovering from mental health crises. So along with the school guide and the district guide for EOP development that I earlier, we have produced various resources that relate to this topic, including a fact sheet on psychological first aid and how to help students recover after a personal, community, or school-based emergency. And it really explores the goals of psychological first aid, also referred to as PFA and its model. We also have a 10 tips for teaching the PFA model for K-12 education agencies available on our site as well. If you are a new friend to the REMS-TA Center, we definitely encourage you to visit our website and to view our REMS on the Air podcast episodes. You can also access them on the Google and Apple Play platforms. We have a series of podcast episodes on really understanding the link between social emotional learning and school safety, and also managing recovery through planning and partnerships. And you can find more resources via our topic-specific resources page. For example, supporting efforts to create a public health, medical, and mental health annex as a part of your emergency operations plan, and also a lot of resources specific to recovery. The REMS-TA Center also offers asynchronous training opportunities, including an online course on developing a bereavement and loss annex. Of course, we hope that that is never used, but in the event that a crisis does turn into an emergency or a loss of life, there are additional downloadable training packages that include modules, again, on responding to bereavement and loss, but also on developing a recovery annex and a self-care plan, because you know, as the mental health coordination team and educators work to support students, they can sometimes experience compassion fatigue. And so it's important to think about resilient strategies that can be designed to support educators. And so we also deliver what we refer to as our resilient strategies for educators, techniques for self-care and peer support, training by request, and we have it in both a live and a virtual format. And so potential training sites, including schools, school districts, and institutions of higher education, school safety centers, can request our trainings. All of the resources and trainings that we offer are free. So we will come to your site with our master trainers to support your school in thinking about some of those resilient strategies. And lastly, the REMS-TA Center, we're also a resource. We are always only an email or phone call away. Please do not hesitate to reach out to us if you have any technical assistance requests on any aspects of emergency management planning. And we really approach things from an all hazards and all threats perspective. And lastly, I just want to thank you all again for prioritizing today's event, for submitting your questions, and for engaging with us throughout I would like to send a special thanks again to Yashi, Lisa, and Addison for sharing your stories today. We really appreciate your participation, and we hope to see you all again at another webinar or to hear from you in the future. You will receive a link in one moment. We welcome you to complete that evaluation survey and to let us know your thoughts on the quality of this event. Thank you again for attending.